Hi, this is review for the NCE. We are under a clinical focus, and today we're going to be talking about financial issues as they pertain to counseling. So, financial issues are a huge spectrum. There can be many different types of financial issues, or you may also hear the term financial stress or money problems. Basically, it's just an all-encompassing term that deals with the overwhelming negative feelings of behaviors as they relate to money. You may also hear the word financial distress. That can have a negative relationship on significant others, family. It can cause a great deal of stress even within family and friends. And many individuals who experience financial issues may benefit from a mental health counselor because many times there are underlying issues within the money behavior. So, just to give you some information, the money is just the behavior that you see, but then what is underneath that behavior, right? So, for many people, they develop money habits such as gambling or overspending or even underspending. And then that trickles down into a lot of financial stress, financial burden, debt, things like that. So that financial burden can be very troubling, but many times there are underlying mental health condition. So a client may report a high level of debt. They may report an unexpected loss of income, so like a little job loss or similar things. They may report an increased financial responsibilities or having a new child or having to take care of a dependent. They also may report various spending habits. For individuals with financial issues, something that is very very common and you should be aware of is the notion of compulsiveness. So things like compulsive spending, compulsive gambling, those are the things that you want to be very aware of. And then that leads to things like foreclosure, bankruptcy, and long term, it leads to poverty. So those are the things that you should be aware of. With mental health disorders such as the mood disorders, depression, bipolar, ADHD, there is a link to financial issues because a lot of those disorders are associated with the notion of compulsiveness. And also, there's other factors such as how the economy is doing, the unemployment rate, changes in industry. All of those factor in to having financial stress or financial hardships for many individuals. So that leads to different types of mental health characteristics such as depression, anxiety, grief. Many times they grieve the lifestyle that they had. Detachment. Many times they isolate or there's a great deal of shame. There's also a correlation of substance abuse or dependency, such as alcoholism. There could be changes in sleep patterns. There could be a change in diet, either under eating, overeating, or having a pattern of change in eating behaviors. There could be, again, the notion of stress, and then have somatic symptoms such as headaches and things like that. So those are all things associated with financial stress. But again, the finance is the behavior. As a counselor, you are looking for what is underneath the behavior that is leading to that maladaptive behavior.